Welcome to Mental Health in Focus, brought to you by Flow Vector Systems. We're passionate technologists dedicated to helping businesses get started and thrive with AI integrated solutions. Find flow state in your business. Now let's move on with the podcast.
Good morning, and thanks for joining. We have Bobby Whitney with us today, and he's from Radiant Autism Center, and he's going to tell us a little bit more about his business, talk a little bit more about autism and how it relates to the mental health care industry, and just have a good conversation about how people can learn more and get started, and then of course we'll wrap it up with a little bit of a technology talk, since we have our nerdy note taker, and I'm kind of a nerd myself. So
Gotcha.
Yeah, so go ahead, Bobby. Let's talk about yourself and your business.
All right. So yeah, like you said, I'm the COO and partner of Radiant Autism Center. We are in North Texas. We have 4 locations here in North Texas. We currently serve right around 100 families, specifically the children of those families, ages 2 to 12, kids that are on the autism spectrum that have a hard time fitting in a typical school setting. And so oftentimes we'll, through early intervention, see those kids from 18 months, 2 years, and then all the way through their school years, with a goal of trying to be able to get them to thrive in a typical school setting. So that's what we do. It's one-on-one ABA therapy. And so for, every time we have 100 kids in center, we have 4 locations. There's 100 technicians working directly with those kids, and then a whole team of clinical supervisors, BCBA clinicians, that are supervising those technicians as they implement the ABA. And so that's what we do day to day. It's in a setting called play therapy. So to the kids, it really feels like they're playing all day and earning special play time through tasks and things that they're doing throughout the day that are all really framed in that play therapy model.
Yeah, so kind of like a gamification type
Yes.
model when you're thinking about like online type stuff.
Yes. Yeah, absolutely.
Okay. Great. Can you maybe just talk a little bit more about the connection between autism and mental health, and kind of just about how people should think about this as they're looking at mental health.
That's there's every answer you can think of for that question. It's a super loaded question, but we'll tackle it as we can. They are different in the fact that people are different, right? And so they're individualized as to there's the majority of kids on the autism spectrum wouldn't have what some people would term as a mental illness. But some of those, if we had a Venn diagram of mental health, mental illness, and autism, they would cross in multiple places. There'd be a lot of shared space, but there's a ton of difference between how the kids on the spectrum are affected by those things. And so while they are kind of grouped into the same arena, they're very different and individualized in what these kids, they're a little harder to diagnose, and that's why it's termed as a spectrum, a little harder to diagnose as having a specific disability or mental illness, instead of a broad array of things that affect the way they interact with the world. It's just it's different, but it's in the same bubble.
Yeah, makes sense.
Yeah.
Okay, great. I'm curious, you mentioned sticking with the kids as they're going through school. So do you help the parents go through that process of getting a 504 learning plan and like all those?
Absolutely. So our clinicians work very closely with the families. We have what we call parent training or parent teaching sessions. It's caregiver is probably a more appropriate term, but it's because we work with the parents, with the siblings, anyone in the community that works with that child, and we teach them and help them in the day-to-day actions, help reinforce what they're doing with the tools that we have. But then we also help them in their ARD meetings with the school. We help them so the school might not be equipped or able to understand what the child needs without our help. And so we'll go in and have those meetings and visit with them as well to make sure that they have the support that they need, they have the information they need, and the tools that we use in order to create an environment where that kid can thrive.
Awesome. Yeah, that's great. I know my own son is ADHD, which is different, but it's sounds like similar treatment, in the providers that we worked with.
Yes.
Yeah. And so helping us through sort of navigating the bits and pieces of, getting the kid through school and, all the support and programs that are associated with that, as well as, sort of the caregiving aspects and really a lot around patience and being sort of nurturing and understanding and empathetic versus like trying to do corrective action, right?
Right. Which serves to a point, but also there is the reality of the world. And so we have to make sure that we do have to sometimes adjust the road to match the child, but oftentimes we need to make sure that we're not just doing that, and that we are also equipping the child to deal with the things that they will encounter, and the human interaction and the things that are real. And so there is a fine line between that, because we want to create an environment where the kid can thrive, but we also need to make sure that we're reinforcing the behaviors that will help them thrive in the real environment.
Yeah, makes sense.
Yeah.
Well, great. Can you talk just a little bit about how you got into this business and sort of where your passions are and that sort of thing?
Sure.
Yeah.
So from a young age, I believe we're made by God to serve others. So that's something that was in our family. That was something that philanthropy and serving the less fortunate was always part of my upbringing. The first half of my professional career was in an arena that was not anywhere near this. I was in retail, I was in sales, I was in management leadership of other types of businesses. And then a little over 3 years ago, made this switch. It seemed to make sense to me. Having that history of involvement from an extracurricular or philanthropic side gave me a framework to where I could apply that to have success in a career that's doing good for others. Mm-hmm. And so my partners had established this company 5 years ago, and I was kind of a supportive factor in that, just in the wings, just helping and mentoring them through that. And then when they had some changes and wanted to scale, I came on board to help in that endeavor.
Oh, that's great.
Yeah.
That's great. Yeah, I'm kind of on a similar path right now myself. I'm coming out of 30 years and working for corporate, and now kind of starting in my own startup business and doing AI for small and medium-sized businesses, trying to serve people, directly versus a giant corporation making billions of dollars, right?
Of course. Yeah.
And so, that's part of my mission here is going out and meeting with mental health related fields and trying to help give back to some of those organizations and help streamline and optimize and do all that stuff so they can serve more people.
Yeah, that's great.
Yeah. Let me see here. Let me go back to the list here. Your thoughts about how someone in need, right? So let's say I'm a parent and I'm like, something's not quite right here. How do I get started in finding the right kind of help for my child?
So I think first and foremost is trust your parental instinct. So it's real easy to deny and treat this with, if I ignore it, it'll go away. Mm-hmm. There's no benefit in that. Early intervention is key. Trust your parental instincts. The sooner you get tested, the sooner you know. Mm-hmm. If there's nothing wrong, then you've got nothing to worry about, right? If there is, right, it's better to know early. It's better to put an action plan in place early. And oftentimes the biggest improvements we have are with the kids that we're able to see early on and really groove some behaviors before they are grooved on their own, really. Right. And so early is better than late, but late is better than never. So just trust your instinct and do what if your antenna's going up and telling you that something's not right, just get it checked out. There's no harm in that.
And then what's the right path to follow? I mean, because I think most parents would say, okay, I'm going to go to my pediatrician, right? And talk to them. Is that the right first step?
Yeah. If you have a relationship there, then for sure. There's child psychologists, there's therapists that deal with this, but your pediatrician is probably the best is the best avenue to give you those contacts and those referrals. If you're not getting the help you need there, there's a ton of stuff online. You have to be a little careful because it'll scare you into thinking that you and your child have every possible ailment there is.
Yeah,
so
for sure.
make sure to curate your search, but there's a ton of help online as well.
Yeah, great. Okay, yeah, that's awesome. I think just getting started, talking to a pediatrician, your pediatrician is only going to see your child, for a half hour at a time, right? Like every month or quarter or whatever. So, they're not going to see and necessarily be able to diagnose that or catch that where you're not able to. Right.
And there's a ton of testing. So take notes, take them to your doctor. Those could be indicators, things that the doctor might not see in the 4-minute visit that they're granted. So take notes, have some data to support that will help them. And then there's a ton of testing. Companies like Radiant Autism do ADOS-2 testing, which is we can actually do the testing for the pediatrician, and then they sign off on it with counsel with our clinician. And then there's other ways. There's a number of other ways to get tested through other child psychologists and things like that. But sometimes those wait lists are months and months, if not a year. Typically, a company like Radiant Autism will get you in from an ADOS testing standpoint in that month or the next. It's much faster. And then most insurances take that, some don't. But even if your insurance doesn't take that, it's little to no cost to do that. And it will at least put you on the path to where you can then seek what you need.
Okay, great. All right, let's move on kind of to the next piece here. A bit about the clinicians that you're working with and sort of the therapeutic approaches there.
Sure.
Yeah, go ahead.
And that's so one of the things I like really, and I didn't know about this before, but one of the things I like the best about Radiant and the way that we operate this is we're very individualized. So it's a client-driven treatment program. So right now I have 16 clinicians, board certified. To be a clinician, it's a master's or a PhD, and then about 2,000 hours of work in center, and then there's a test equivalent to like what the bar exam would be for an attorney. So it's a pretty tough way to get a license, but it's what all of our clinicians have. So we have 16 of those. Sam Douglas is our executive clinical director, an absolute rock star, and she's built a team super competent, but with low ego, which is great. And so with that, we have this really multifaceted, different disciplines. They're great at different things, but they collaborate to make this one unit that is, I would say, the best thing about our team is 100% heart committed to changing lives. And just the fact that they are all in it for the right reason. And yes, it's their profession. They studied hard for it. It's their career, but they show up every day to serve a set of clients that sometimes doesn't want them there. Sometimes they hit them or run from them or spit on them. And the next day they show up again to do it again because they know incrementally they're making changes in the lives of these families and creating opportunities for these kids that they wouldn't otherwise have. So that's the clinicians I work with. And each one of those clinicians has a team of technicians that as they write treatment plans for the child, the treatment plans are then carried out by the technicians under the supervision of the clinicians. That's how really how the therapy works. Yeah,
that makes sense. And it's a beautiful story, the way you tell it, about these folks and, the discipline it takes to get through all of the education and the work to get to this place where you're certified to do this type of work. Yes. And then go in, like you said, low ego, big heart, and just keep coming back to help these kids. That's a beautiful story.
Yeah.
Let's see. We talked a little bit about in our preview call about the mental health of the folks that are actually doing this work, right? Your clinicians, your technicians, and the folks that are dealing with some of the blowback, I guess, from the patients. Like, how do you think about that, and how do you work with them on that?
That's not only a huge buzzword right now, but a very important part of our day every day. My main job is to create a safe environment for my team to provide this care.
Mhm.
the ABA therapy, it's medically necessary, and I have to create an environment where it's safe for them to do that and that they can serve these kids in need. So that's job one. But outside of that is each individual. We have almost 140 employees right now, and they each have their own, they're in the middle of their own day, and their own struggles. And so if you go in to a job like this where the interaction from the client could be tough all day, and you're in that for 8 hours, it can be exhausting. It can be mentally draining. I like to term it as difficult, not hard, because hard things are rarely have a reward, but difficult things like climbing a mountain always have a better view, right? And so that's how I like to think of this. Is it is difficult, but it's difficult for a reason, right? It's we know that there's something better for these families at the end of what we're doing, and so a difficult day is okay as long as you're prepared for it and supported in it. And so after that main job, it's about making sure that they can deal with issues that inevitably will come up, right? So we owe them support, but we also owe them accountability. It's okay to have a bad day as long as we grow from it and we don't let it defeat us. And so I think that in mental health, we have to be careful that mental health doesn't mean avoiding these things. It means recognizing them and reinforcing ourselves so that we can better deal with them when they happen again, because they will. Right? Tough days are part of days. And
that's right.
If we are equipped for those, I think we better serve ourselves and our clients and our families. And so that becomes part of it as well, to create an environment where we support it. Sometimes we all need coddling, but for the most part, we need encouragement and support. And that's what we try to do to make sure that our technicians and our therapists know that they're valued. They know they're doing a good job. They know they're making an impact in these families' lives. And when you see that and we see what these kids deal with on the daily basis, it makes it easier to deal with your own stuff, because it doesn't seem quite as big when the why you do it is bigger.
Yeah, that's fantastic. And I love that your organization is wrapping their arms around, you're wrapping your arms around your employees and telling them, I'm here for you. And
right. Yeah, for sure.
That's super great to hear. I mean, I'd say working in big tech over the last 30 years, didn't get a lot of those good feelings, right? Yeah, it was like, oh, okay, you did what today? Oh, that's amazing. Do more tomorrow.
Yes.
Yeah. So fantastic. I'd love to hear that. Let's talk a little bit about the challenges, outside of working with the individual patients and some of those other things in day-to-day work for your executive team, for your clinicians and the technicians. What are some of those big challenges that they have dealing with just ordinary business process?
So the first one that you mentioned in there is the with insurance. It's we can't do our job without it, right? Insurance pays for these services, but in the insurance lineup, there is they make it very difficult in order to get the money for the services you render. And so that's probably one of the biggest challenges, is chasing dollars that you've already earned. And sometimes those dollars take 45, 60, 90 plus days to come in when payroll is due next week. And so from a business owner standpoint, we're rendering services with a ton of employees, trying to keep them well compensated, paying them with today's dollars that we actually won't see for a while. And so that's a huge challenge in any, I think, insurance driven business. But so that's one of the biggest challenges. Another one, there's some legislative stuff out there. There's some folks that are doing this business incorrectly and is creating some havoc for others. There's some scams and scandals that are happening that will make insurance companies, rightfully so, have to be more stringent on the way they check to make sure it's done right. And that's going to make it more difficult for those of us that are doing it properly. It just makes more hoops to jump through, and it makes it harder to to get the money to provide the services that the kids need. And then as that landscape changes, we have to stay real agile, but we serve a population that really typically doesn't deal well with change. And so we have to make sure that we're agile from a professional side without causing disruption in the services we provide to the kids.
Yeah, it makes sense. So you're basically, you're front loading all the costs and hoping that all catches up on the back end with insurance.
Yes.
I think when I was going on my own journey through mental health, I went to a residential plan. I went to sort of an outpatient type plan as well, and
Sure.
the costs on those were mind-boggling. I can't imagine someone paying out of pocket for that. Luckily, insurance covered it for me.
Right.
But you know, it felt to me like there was a little game going on there with how much they were charging and the services they were providing. And I wonder if it's similar what you're seeing here in this industry.
Yes. So the care, and they've made it so that the margins are really small. So we have to be almost militant on efficiencies, which sometimes takes the human element out of it.
Right.
Right. And so we're judged on compensation based on 15-minute increments. And if there's a certain number of minutes in that 15 minutes that aren't productive, it's non-billable. If the I's are not dotted and T's are not crossed perfectly, it's kicked and denied. And so we have to have a human element to help these kids that really need our help.
Right.
But we have to have systems around it that are so stringent that sometimes it forces us to be a little more robotic than we would like to be, just because we have to be compliant to what the insurance company asks when they've never met the child. They're not in the middle of the behavior of that day that's going on, that it's all hands on deck. And we have 4 technicians trying to help one child when insurance will only let us bill for one of those. And that takes away from what the other kids can get in that moment. So insurance is the reason we exist from a positive standpoint, but it's also the reason some of these companies don't make it, because of that front loading expense and just how stringent they are on payment.
Yeah. So with all the red tape that is wrapped around the care here,
right.
If I'm looking at a clinician and I'm saying, here's an 8-hour day, right? How much of that time is spent giving care, and how much of that time is spent doing like office work, and some of it, and the rest of it, like how much is that insurance? Just like piece?
Well, we've tried to separate it significantly. So we have a team on the back end that does all the billing and insurance communication. And then we have a scheduling team that does their schedules on the front end with all the details, and the parent communication. So the technicians are with their client. And this is where I say it sounds like we have to get, we have to really be very focused and almost be militant on it. And we run technician is there. They're about 94 to 95 minutes. 94 to 95% of their time is with a client.
Wow.
And so we have it down to where really we burn just a few minutes an hour of non-productive time for a technician. Now, a clinician is a little different. They get to pick what their schedule looks like. And sometimes the clients will need a ton of supervision. So they'll be, if the client's there 40 hours in a given week, that child might be with that clinician 5 to 8 of those hours, specifically directly with that clinician and a technician. And some don't need quite as much. Insurance allows up to 20% of their total time to be with a clinician. And we average kind of 12 to 14% of their time. But that's where a technician and clinician really need to communicate on what that client needs. And if it's a high needs day, then that clinician might be supervising for a good portion of that day. And so they get to really curate their time and do it as they see fit. And they have plans for all these kids. It's very data driven. Every minute the technician is with the client, they're charting. And so they're able to see where they need to interact. But it is pretty data intensive for them to be able to discern when they need to be with that client.
Yeah. Interesting. And I'm curious, data intensive, what are some of the technology pieces that you're using to kind of connect all that stuff together?
So yeah, there's a platform we use called Central Reach, and it's probably the most common one in ABA therapy. There's a number of them out there, and it's a data collection tool that tracks the schedules, it tracks attendance, all the data that we collect. It shares it amongst it. It draws the charts and does the things for us. but there's still a lot of human interaction in a space for error in that. So there's some of it has to be manual, and so it's there is a chance for us to need correction time to go back and rework claims. Some of it's AI facilitated to create some efficiencies in there with the notes and the treatment plans, but there's still a ton of human data collection, which is, I believe, necessary because the person needs to be with the client, and they're able to see the small things that the computer might not catch, just the human interaction side of it.
Yeah. Are they scribbling that in or typing that into an iPad?
Tablet. Yeah, we have them on a tablet, and there's some preset things that they can go in and click on, but a lot of it is manual entry in that, and then it's reviewed by the clinician, and if there's questions on that, then they kind of go back and rehash that. But it's all in all, it's a lot of manual data entry.
Yeah, makes sense.
Yeah,
I think that the human eye and observation, you can't automate that, right?
Right. Yeah. Yes.
Makes sense. Let's see. Anything else as far as like different areas of the business that are challenging, like places that you say, there's a lot of manual work, but it's really necessary in this place where you need a human interaction. Is there other processes that you see that are like potential automation scenarios that you might be looking to explore?
Yes, and some of them I'm really excited about. Some of them really scare me. So it's kind of one of those things. I think AI in general is that way for a lot of people. To where we see a lot of ways it can make our lives a lot better. But I also see where it can remove some of the things that makes our life real. And so I think with ABA therapy, it helps our productivity. AI can help our productivity. It can help our processes. But there's still just a huge human element to ABA that belongs there. Success for our clients is adapting to the real world, and that involves human interaction. And there are some software or some AI stuff out there right now that creates, therapy bots for kids, and they're able to be on screen and gamifying their learning and their ABA therapy, which is terrific in small doses in session.
Right.
But it creates someone who doesn't interact with people, and interacting with people is where life happens. And so we have to be careful that we use AI for good and for enhancing and increasing our efficiency so we can provide more hands-on care, because these kids need hands-on care.
Right. Yeah. I mean, it seems like that would be the number one thing. Like this is just supplementary. Maybe you could do a few minutes or a half hour a day where you just get a little bit of exposure to that, and you're moving on. You're doing other stuff with the other humans. You're there
exactly. We've got to deal with them. We might as well learn how. Right. And so that's a big piece of it. And so and that with us, every clinician believes that what they're doing is really pointed towards the highest quality of care. And so that high quality of care takes that human touch and interaction. It takes all of that. And that's really why we would implement anything AI, is to free up time for them to be more hands-on.
Absolutely.
That's really the way it would work in our world.
Yeah. And that is absolutely my mission in, talking with folks in the mental health care space is like, yes, there's so much work to do, and there's such a huge demand for services. Like, how do we get a bunch of this stuff off of your plate so you can serve more people, right? And it's not about automating the care necessarily. It's about automating everything else so you can spend all your time focused on your mission, what you really care about, what you really love doing, and helping more people.
Yeah, and we do use some AI for that. We also, that's the reason we have some of our corporate structure is full support. Most places, unlike Radiant Autism, most places have the clinicians have to handle their billing problems and have to handle scheduling. If we take that off their plate, that's just more time they have to pour into their mission.
Yeah, absolutely. So do you say that's something you're working on, or something that you're interested in?
Both.
Oh,
so yeah, we have AI tools that we use for some of the back-end processes. All of our scheduling is done AI. If you think about, 140 employees and 100 clients and getting all those schedules to match. And if someone doesn't show up, what that looks like, that's all AI driven right now.
Yeah. Okay, good. That's perfect.
Yeah.
I know trying to manage that as a human is pretty overwhelming. We could burn somebody out pretty quick, right?
Oh, yes.
Yeah. Okay, cool. Anything, we talked about KPIs for a second. What are kind of like your top line KPIs that you're tracking for your business?
So for us, it's hours and productivity. Those are some of the biggest ones. Is when our clinician, greets a client, they make the assessment, they prescribe what they think is medically necessary for improvement. That could be, on average, we have our clients are with us about 33 hours a week. So it's almost a full-time job for them.
Yeah.
And so while they're in session, we need those minutes to be productive. And so they are in 15-minute blocks. So we track those, and we try to create efficiencies. We try to move things out of their way so that they can focus on therapy and care, and ABA therapy and treatment during that time. So that is the KPIs that we track the most. And then on the back end side is when we send bills to insurance, how fast do they pay, how often do they pay, and what do we need to do to clean that side up? To me, the high quality of care is the most important goal. And so for us to do that, we have to have a successful business to do that, because if our business is successful, we can advance the quality of care even more, because that success, for me, it builds margin. It builds margin in employee time, because I can buy the right software and equipment and support for them. That margin, it also provides funding for us to grow the business, to reinforce the employees, monetarily, and with the right tools and things like that. And then all of those things, I think, lend to the stickiness of our employee base, and our team wants to stay longer when they feel like we're pouring into them, and their satisfaction is higher.
Yeah.
And that makes, I think, a better culture. And when we have a better culture, ultimately, we have a higher quality of care. The highest possible quality of care is when someone has been there for a long time and they care about what they're doing and they're pouring into that child. They feel supported in that. That's the ultimate. And so that's all tied to, a lot of times in clinical world, you have the clinical side and the business side, and they feel like they're very separate. I think they are, there's all that is synergy. The better we can do as a business is the better we can support the clinicians. The more the clinicians can give a higher quality of care, which we are then rewarded by a more successful business, which allows us to do that over again. Right. So that's the cycle where I think the KPIs matter, and I can get really deep in spreadsheets and kind of nerd out on all of that stuff. And that doesn't help a child that day. But I think if we watch it closely and we turn the dials where we can create the most impact, that allows us to give more people the opportunity to have services from us, or for us to have more employees that do it.
Yeah, the virtuous cycle is what I'd call that, and then having your business in flow state, right? And it's not just care, it's not just running the business, it's not just growth and tracking numbers and making sure you're getting money from insurance. It's all of that stuff, all working in rhythm, in flow together, creates that virtuous cycle. Yeah, and that's part of why I named my company Flow Vector, was just that flow state. Is something I'm really focused on.
We are rarely in, the stages of business are, the forming, storming, norming, and performing. And we're very rarely in that flow state, because we're always in the storming state as we're trying to grow and expand and scale. It seems like one day I would love to be in flow, but
it's tough.
Cross my fingers and wait.
Yeah. Well, it's definitely a good goal to put up on your list, right?
Right.
And so that's kind of where I try to come in and help folks, is get rid of some of that noise, so that you can get into that flow state and really have your business thrive and go towards your strategic goals. Particularly quality of care and growth. And I'm curious about growth. What are your thoughts on growth, and do you have an idea of 2 to 5 years out how many people you'd like to be serving?
Yeah, so we currently have right at 100 families in care, and we are right next to capacity. But 3 of our facilities are expanding currently, and so we will almost double in our square footage. And so, hardest step with that, it's easy to get square footage, it's hard to fill it with good people. And so the next step is just finding the right people to fill it so that we can, serve at the same level. Because I don't want to have any dilution of, culture or quality because of scale. And so that's something we're trying to stay really close to is, how do we grow? We just put in a new position for clinical training. That's a full-time staffer, that's a clinician here. We have CEUs available. We're doing all sorts of stuff to make sure we're training to get our team stronger so that when we do add layers of staff, that they're surrounded by really just highly trained people, and we're able to keep culture and keep quality of care high.
Great. So potentially over the next couple of years, you could double the number of your kids served here.
Yes.
Yeah, that's fantastic. And again, you said you're in North Texas, is that right?
Yeah, we are. We're DFW North, the north end of the DFW area. And then, so we have a clinic in Denton where the University of Texas is. We have one in Sherman, which is almost to the Oklahoma border. And then we have 2 that are just right outside of Frisco in towns called Aubrey and Little Elm.
Okay, great. I have a brother that lives there in North Texas, just south of Fort Worth. And I'm trying to remember the name of the town, but it's escaping me right now.
It's a big place. So we'll be at 10 million people before you know it.
Wow. Amazing. Well, in that 10 million, I'm sure there's a lot of kids that need some help. And so
there's a ton. And that's, we have wait lists. We'd love to get through those wait lists. And that's why we increase the space that we have. And then if we see an area that's underserved and we need to put a location in, that's a possibility as well. So in the next 3 to 5 years, to finish a very long answer to your question a minute ago, was in the next few years would be to have additional locations, more space, and to serve more families. I think in the 200 to 250 families, given our current structure, is what we could handle. It would take another facility or 2, and that would be okay. And then I think that is kind of what the next 3 to 5 years should provide for Radiant Autism.
That's great. Yeah, that was one of my questions as well, is like, as you're looking at growth, it sounds like you already have the demand, right? Like
yes.
You could probably fill up the spaces that you're gonna free up. So like going out and marketing and trying to get more patients lined up is not necessarily something you need to do.
That's not the hardest part. The hardest part is on the clinical side. There's more job openings than there are licensed clinicians.
Yeah.
And so that's the hardest part. And then all the licensed clinicians that are out there aren't great. And so we've got to make sure the ones we have are. And so right now we have a team of 16 that are awesome. And so, we wouldn't just hire any of them. And so that makes the talent pool even tighter than it already naturally is.
Yeah. Makes sense. Well, I mean, for long-term quality of care, you have to be that picky up front, right?
Oh, yes.
So, yeah. Well, Bobby, is there anything else that you wanted to cover today before we go?
I think we've hit everything on our list. I think the message is, as we think about mental health and how it, aligns with autism, it's just that it is individualized. It is, every person is different, valuable in who they are and how they are. And then some of us have the opportunity and the ability to help them in that. And to be that has been a great part of what Radiant Autism has brought to market. And so super proud of that, super proud of our team. And just we're going to go out there and just try to do it more.
That's awesome. Well, I appreciate all the love and care you put into this business, and I appreciate your background and coming in and saying, hey, I actually want to make a difference out here, and to be able to do that and still run a career is fantastic, and being able to find something that's rewarding outside of just a check.
Absolutely. Well, I appreciate you. Appreciate the time and the thoughtful questions and our ability to get to some things that might help some folks if they listen.
Yeah, absolutely. Yeah, I appreciate that. And outside of this, as we think about growth and possible ways to automate some of the different processes within your business, I'd love to have a follow-up call with you on that and
Sure.
see if there's somewhere we can help out.
Awesome.
Awesome. All right. Thanks, Bobby.
Appreciate you.
Have a wonderful day.
All right. Bye.
You too. Bye.